Thank you very much. Honorable Ministers, Dr. John Ward, Dr. Mohammed Janabi, Excellencies, Ambassadors here present, distinguished guests, ladies and gentlemen, a very good evening to you all. I am honored to join you for this 4th annual meeting of the UN Group of Friends to Eliminate Hepatitis. I bring warm greetings from the African Union Commission and deep appreciation for the growing coalition of member states, civil society, and technical partners who have made hepatitis elimination not just a possibility, but a global imperative. In particular, I thank the permanent missions of Brazil, Egypt, Malaysia, and Uganda, as well as the Coalition for Global Hepatitis Elimination for your leadership. I also commend member states, including new African members, for their unwavering commitment to the 2030 elimination target. We meet at a time when the world is rethinking its health architecture, its diplomatic priorities, and its moral compass. In this moment of recalibration, hepatitis elimination offers a litmus test. Can we build a world where silent diseases no longer thrive in the shadows of neglect? I think the answer should be yes. Africa carries a heavy burden of hepatitis, with 70 million people living with hepatitis B and C, and hepatitis B as a leading cause of liver cancer. Yet, hepatitis is both preventable and treatable, but it remains underfunded, underdiagnosed, and under-discussed. This is not a failure of science. It is a failure of solidarity. Today, we gather to reverse that trend. African member states, such as the Gambia, were among the first in the world to demonstrate the impact of universal hepatitis B vaccination. Egypt has implemented one of the most extensive national elimination programs globally. And Rwanda, along with several others, is integrating hepatitis services into primary health care and universal health coverage. These achievements show us that elimination in Africa is not only possible, but it's also within our reach. The African Union has long recognized viral hepatitis as a critical public health challenge and acted through the Africa Health Strategy 2016-2030, which specifically calls for a reduction in morbidity and the elimination of preventable mortality from communicable and non-communicable diseases, including hepatitis, across Africa, as well as the 2020 Cairo Declaration, committing to eliminate viral hepatitis by 2030. We have also launched the Triple Elimination Plan addressing HIV, hepatitis, and syphilis, which began in Uganda and is now being rolled out across the continent. These commitments reaffirm Africa's determination to address hepatitis as part of a broader health, security, and development agenda. Africa's dual burden of communicable and non-communicable diseases presents a significant opportunity for a more integrated and effective health strategy. By embedding the prevention and management of NCDs like cancers, hypertension, and diabetes into existing hepatitis prevention and primary care, we can provide efficiency. Also, aligning health promotion campaigns for both chronic diseases and viral hepatitis will strengthen patient-centered care, bolster health systems, and accelerate progress towards hepatitis elimination by 2030. Excellencies, health financing is critical to achieve our goals. Since the historic 2001 Abuja Declaration, few countries have allocated at least 15% of their national budgets to health. Today, we shall strongly reaffirm that pledge and underscore its centrality to sustainable hepatitis elimination. Strengthening domestic resource mobilization through innovative national health financing approaches is crucial, as highlighted in the recently launched African Union Roadmap to 2030. Reaffirming the Abuja target is essential, not symbolic. Without sustainable domestic financing, hepatitis elimination will remain out of reach. This strengthens health service systems and signals the political ownership needed to overcome the declining external financial support. The group of friends has created a unique political platform. Today's gathering must translate momentum into concrete financing, stronger partnerships, and measurable action. Africa is ready, but we cannot do this alone. Hepatitis elimination requires global financing mechanisms that prioritize prevention, testing, and treatment. Diplomatic leadership that elevates hepatitis in UN resolutions, high-level declarations, and SDG reviews. Community engagement that dismantles stigma and empowers those most affected, and data systems and innovation that guide policy and measure progress. The African Union stands ready to work with partners to convene a dedicated high-level meeting on hepatitis, ensuring that this issue receives the visibility and political leadership it deserves. I call on the international community to join Africa in closing the prevention, testing, and treatment gaps. Investing in hepatitis elimination is not only cost-effective and life-saving, but it also reduces the growing burden of liver cancer and other non-communicable diseases. The fight against viral hepatitis is a testament to our shared humanity and collective responsibility. Through stronger policy frameworks, sustained domestic financing, and deeper South-South cooperation, Africa is well positioned to help lead the world toward a future free from hepatitis. Hepatitis remains a major health global challenge, with Africa carrying a disproportionate share of the burden, as stated earlier. Convening a UN high-level meeting on hepatitis elimination will provide needed political platform to strengthen commitments, mobilize investment, and accelerate elimination efforts. The 2026 World Health Assembly presents a timely opportunity for member states to advance this agenda and prepare the ground for the proposed high-level meeting in either 2027 or 2028. This will be a step in the right direction to mobilize political will, secure financing, and accelerate progress towards eliminating hepatitis as a public health threat by 2030. Hepatitis is not just a health issue. It is a justice issue. It is a development issue, and it is a test of our collective will to leave no one behind. On behalf of the African Union, I reaffirm our solidarity and commitment to transforming today's discussions into tangible progress. Let us move from commitments to action. My prayer is that this meeting will mark the moment when hepatitis moved from the margins to the mainstream of global health diplomacy. Together, we can make hepatitis elimination by 2030 not just an aspiration, but a shared reality. I thank you for your attention.